Well, awesome. So I am just so happy to have you here today.
I'm happy to be here.
Very glad you've been able to view the office, see what it's like in here.
Yeah.
And obviously, after having that conversation with you, I was very excited to have you come in and be interviewed, not just for our patients in our office here, but also for our listeners whenever with our podcast and also online on social media. Mm-hmm. Definitely for people local, but then also for people that are outside of the Northwest Arkansas territory. So that way they can just hear these perspectives, because as you are probably well aware of, women don't always know that they have choices, right?
Right.
In and around birth. So without further ado, I just want to thank you, Susan, for being here. Yeah. Also for our listeners that have Susan Holt here with us, right? Yeah. And I just really want you to be able to share what it is you do. We'll go through and just find out a little more about you and your perspectives when it comes to women and pregnancy and their bodies and what you've seen, and especially more what it looks like going more of a natural route versus what you've seen other routes as well. So just talk about who you are and what you do.
Okay, great. So I'm Susan Holt, and I have been a childbirth instructor for about 12 years. So I was method, and I taught that for 10 years, and then I went on to develop my own course, and I've been teaching that for several years now. And I have 4 kiddos myself with my husband, and they are now ages 6.5 through 13. And so I started teaching childbirth classes after my oldest was born, just in response to our experience and the experiences that I was seeing other people go through. And it's been a really good. I never thought when I was growing up that I would be a childbirth educator or that I would work with pregnant moms or moms in general, but here we are, and it's been a great life work. So yeah, I really enjoy working with pregnant women and postpartum and just moms in general, and babies. Of course, that's part of the best part of my job is seeing pictures of my kids.
Yes.
Yeah.
So more specifically, so you've been educating for the past 12 years,
yes.
Right? So give me a little insight, and our listeners a little insight on what it is that you're doing. Like, what are these workshops that you're doing, and how hands-on is it, and then resources. Just start to elaborate on that a little bit.
Sure. So my current course, my core course that I teach is a 5-week class, and we start with having a healthy pregnancy, nutrition, movement, anatomy and gestation, the hormones of pregnancy, all of that. And we move into, once we have that foundation, we move into the stages of childbirth. What your body's going to go through, what is the normal process, what to expect, and then we talk about how to deal with that, comfort measures, and I talk specifically to mom's partner and say, hey, look, this is what you're going to experience, this is how you can help. So some coaching instruction, and just generally getting them ready how to work with their bodies.
Oh, I love it.
Because not every plan, because some routes have a detour. You got to be prepared for if something is a variation or if there's a complication. We don't want to, turn a blind eye to the fact that some things are weird.
Yeah.
Some things go wrong, and we need to have a plan and a preparation for that. So we also talk about how to plan a birth, how to do your research to figure out what it is that you want, how to get that, and how to work with your care provider to have the best experience possible. And then having a plan in place for handling variations and complications, understanding how to ask questions, how to understand the benefits and the risks, what some alternatives are, and having good open communications with your care team. And then finally, we talk about the postpartum stuff. What happens after baby gets here? How do you recover your own body? How do you start breastfeeding? What support do you have out in the community that you can reach out to if you have problems? If you have postpartum mood disorders, or if you have breastfeeding issues, or if you're having trouble with your newborn. We talk about newborn care, how to change diapers, how to care for an uncircumcised boy, and all of the things that we don't necessarily hear in our everyday mainstream. Right. So yeah, it's very comprehensive from pregnancy all the way to the end, and that's my core class. And you won't find a more informational class out there.
Oh, I love it. That means that you're dedicated to your work. You
Yes.
love what you do, and I'm sure you're continuously learning new things.
Of course.
All the time, and then
Right.
thinking of how can I implement that. And what I love is that you directly mentioned about how to have that conversation with the provider, because as many people know, it can be very intimidating, especially being your first pregnancy, even a second pregnancy, as we were talking before we started recording this right now, that it can be very intimidating and hard for women to realize that, one, it is their body and they do have the choice, and how do they relay that message to a provider, especially if it's a provider that wasn't exactly planned during the time that they might be going into labor. So I love that you provide that. I'm assuming you maybe have like questions for them to think about, so that way it's just like it's like instinctual for them to ask these questions, like, do I need this? Should I have this right now?
Right.
What's your alternative plan if this doesn't work?
Yeah, definitely. Informed questions for informed consent. We talked about that several times throughout. And then, how to have that positive and open communications without, you want them on your side.
Yes,
right.
absolutely.
So without turning them away, because, sometimes care providers have an ego.
Yeah.
And, work with people as people.
Absolutely.
Yeah.
Oh, I love hearing that. That's just wonderful. And I didn't even realize the extent of even after the baby comes out. I mean, it seems so simple, like changing a diaper, but it's not always. I mean, maybe you're used to changing girls instead of little boys, and sometimes there's streams that come at you, and you just want to be aware of different factors and everything, especially with uncircumcised boys as well. I love that you even educate. What do you do that's different? Is it still normal? Yes, it's absolutely normal. It's a choice whether the parent wants to do it or not. And if they decide not to, here's different ways to take care of.
It's still a surgery. It's still an intervention, and you got to be educated about what kind of choice you're making, and because you're making it for another person. So you have to really know why, and your what's going on,
and why. I love that. Absolutely love that. Yeah. So we might have already touched a little bit about it, but what is your mission within the work of what you do?
Right. So in addition to childbirth classes, I also work with pregnant and postpartum women with their bodies. So working to prepare their bodies for birth, working with them postpartum to help them recover, trying to avoid things like excessive diastasis recti, the separation of the rectus muscles, pelvic floor issues. I work with them during pregnancy to help them have a more effective and safe labor, so that we don't have arrested labor where baby kind of gets stuck.
Right.
Getting some balance and making sure we don't have muscle imbalances and things like that. Getting them ready for birth, and then addressing any issues that we might have postpartum. Any diastasis that may still be hanging around, pelvic floor issues, and other discomforts, just general weakness, low back pain, upper back pain, posture, as moms get into this breastfeeding world, and constant looking down at their babies. Yes. Work with them on how to baby wear safely if that's something that they want to do. Which
so you do talk about baby wearing as well.
Yes, and then working with moms, even those who have toddlers and preschoolers who, are just trying to figure out how to move in their bodies and deal with this new thing that they have going on, and addressing those. So really my love is working with moms and making them feel empowered and inspired to take care of themselves, and so that they can also take care of their babies. And education has always been a huge component of any of my classes. So if you come to a childbirth class, I'm not just going to tell you what you should do. I'm going to explain, hey, look, here's the evidence behind what we're, or here's the evidence behind your choices. If you come to an exercise class or to a private session, it's going to be, hey, look, I'm going to ask you to do this movement. It's because this is what I'm seeing. This is why we're doing this thing. So really helping people understand what their bodies are doing, how their bodies are working, and how to work with their bodies to feel great is really important to me.
Yes, and it's very much you align and agree with it too. Like woman having already had 4 kids. I haven't had any kids yet, but I feel like it's like I'm just learning so much as I continue to love on these babies, because I always look, as a chiropractor, we look at the body, like how is it supposed to function naturally? Like you're talking about with the upper back pain with moms, because they're looking down and breastfeeding. I'm all constantly reminding moms that we have to think about the new positions that you're in. Like, you always have to work to keep up with your body demands. What are the new movement patterns you're developing because of you working with your baby and breastfeeding, which is such a spiritual, such a great connection with you and baby for the many reasons that we know breastfeeding is extremely beneficial, right? For their natural immunization. Breast milk provides everything that the baby needs. But on top of that is also with that pregnancy process being very much as I like to say, a very spiritual experience if the mom has that confidence in her body, right? Yeah. And so I love that you just really help to just provide education within that. What would you say is the best point to start doing these classes?
Which classes?
So say I'm a mom that plans to get pregnant and I plan to get pregnant. Would it be good to come see you even before I'm pregnant?
Yes, for sure. Because if I see somebody before pregnancy, I'm looking at postural issues, like what can they do now that's going to help influence how well they carry the baby, that hopefully will help them avoid some of the common issues that we see during pregnancy, and developing that deep arch in the low back and carrying with a tilted pelvis and things like that can go on to other issues. Or if I see muscle imbalance in the legs or the hip muscles, I might suggest we need to address that so that we can avoid pelvic girdle pain and pubis symphysis dysfunction and things like that.
See that a lot.
Exactly. And so sometimes we can, and it works really great in conjunction with chiropractic care, because when you can address the neural issues and the spinal issues and reinforce that with strengthening exercises and release exercises that can help the muscles do what they're supposed to do,
right, exactly.
and function to reinforce that stability. I mean, it makes all the difference.
Yeah. So you do see that marked difference then, because you also have a resource of different practitioners and different physicians that you work hand in hand with, right? So how, just from your experience, how has it been working with moms throughout their pregnancy that have been getting adjusted with chiropractic care versus haven't been getting adjusted? Do you see a difference with that?
I do, and I don't even have to see a difference, which I do, but I can. They say it like they just come right out and say, "Hey, I feel so much better. I couldn't have done it without. I can't imagine having been pregnant without chiropractic care." And that was my experience too. I had chiropractic care through 3 of my pregnancies, and made a huge difference for us. So yeah, it definitely makes a difference for that. And then, anytime somebody does come to me with an issue, I'll address it from a muscular standpoint, but then I always suggest additional care providers, physical therapists, chiropractors, massage therapists that can help reinforce and help along that road, because we're, not everybody can meet every single need. So
exactly, and that's the beauty of it too. And you shared that with me when we have discussed this prior to this, is that you're like, I don't want to get out of my lane either. Like, you have a massive understanding, but at the same time, you're like, well, I know I want to work directly with people who do pelvic floor dysfunction if I see this with someone. Right. And and plus you understanding and experiencing chiropractic care yourself, so you have that benefit of understanding that, and I just absolutely love that. So it's like when you said birth team, it really does help to cultivate that birth team for that individual,
right, for
going
sure,
through this amazing experience, right?
Right.
Oh, absolutely love it. So a couple other things I would say that maybe other people would want to know is, what are the most common misconceptions women have about pregnancy? Oh,
I love this question. I think one of the biggest misconceptions that women have during pregnancy is that somebody is going to tell them what to do. That they don't have to make choices, that they can just go in and somebody's going to fix them. And like, okay, I'm just going to do what my doctor tells me to do and everything will be fine. Or that if they follow everything that their care provider says, that they'll have a perfect experience. And it's just not the case. In the United States, the typical care that we receive in the United States is not evidence-based. The percentages are way off, and if we don't act as consumers in our care in our own personal care,
Yeah.
then we're doing ourselves a disservice. So I think I would really encourage women to understand, hey, look, you are, this is your body, this is your life, this is your baby.
Yes.
You have to take ownership, because pregnancy and childbirth, it's not the last time that you have to make decisions.
No, absolutely not.
It's not the last time that you have to understand what you need to do. Look, okay, my kid has anxiety. How do I deal with anxiety? I should just go to the doctor and get some medication, right?
Yeah.
Well, what if there's something else? Can we do some research and figure that out? If you've never done it before, if you didn't do it during pregnancy, if you didn't do it during the newborn phase, then it just becomes harder and harder. But if you can take that ownership during pregnancy and during postpartum, then you have that confidence to be an excellent parent who can advocate for your child and take care of yourself and your whole family.
Yes.
Yeah.
Education, we always say, like, knowledge is power, and like we always know knowledge is power. It aids in the healing process, but it aids in the confidence of the body too. So you've seen that. So you mentioned, like, with a child who might have ADD or ADHD. So do you work with children as, like, at that point in time, or is that where you're like, well, you have physicians or practitioners that would be helpful working with a child like that?
Yeah, I definitely have a resources to refer to those. But especially I find that if I'm working with mom and giving her the skills, because one of the things that I do with corrective exercise is teach proper breathing skills. And somebody come in and they're like, I've tried everything and I just can't get healing. One of the first things I'm going to tell them is to meditate and relax and get into that state, because we spend so much time at this high or moderate stress level, in the sympathetic nervous system, that our bodies just can't, there's nowhere for it to go. They can't react to stress properly.
No.
And they have a hard time dropping into that relaxed state where we can get healing, where we can get reproduction, all of the things that we need to happen to have our bodies be healthy. So once we start to work on incorporating that relaxation and the breath work and things like that, I noticed that it translates so well to children. If they see, if mom is doing this, there's energy
Absolutely
that goes along with that.
Absolutely.
And the children pick up on that. The mom can give those skills to her kids. I do it with my kids, teach breathing to my kids who who occasionally have anxiety issues, it's from the top down. From the top down, it makes a big difference.
And we know the mass amounts of stimulation that we require now. I mean, gosh, there's like market studies just briefly talking about this on just to capture the attention now. I mean, we have the attention span of a fish, is what they say. That's crazy, the attention span of a fish, right? And so now these children that are coming out and they're used to being constantly inundated with all this stimulation, like even the kids playing video games, look how graphic it has to be stimulating enough for them to be invested in it, right? So what are ways that, that whole breathing exercise is a great way for them to tune back in and not have to have so much bombardment from the outside, from the lights to the media, to what we're hearing all the time, to their video games and everything else, let alone these technology, telephones, right? We're very happy for technological advances, but at the same time, it really has disconnected us from ourselves. And then even this eye-to-eye, face-to-face conversation, I realized too. So I love that. Oh, I absolutely love that you work with that.
Our bodies are really interesting if we stop and listen to them. But a lot of people just don't know how to listen to their bodies.
Right.
I'll work with somebody and they'll say, I don't know if I'm using this muscle or not. Because they don't know how to listen to their bodies.
Right.
I don't know where this pain is coming
Tune in
from.
to feel it. Like, where do you feel it? Like, you could be squeezing and doing exercises right now as I'm talking to you, right? Oh, I love it. Yeah. So let's rewind a little bit. So what are your views on home birth?
Okay. So our first baby was born at a hospital. We had a childbirth. We'd taken a childbirth class, and we were well prepared overall. It did end up being an induction. And there was a time where I realized I probably should fire my OB, but I didn't.
Oh,
and we can talk
good.
about that some more.
Yeah.
So it ended up being, I didn't have any epidural or pain medication, but it was lots of interventions. And it could have been a better experience. And knowing some of the things that I teach now are really geared toward, hey, look, these are questions that you can ask. And we tried to ask questions.
Right.
I feel like we could have had a little bit more skills in there. So then we went on to have 3 home births with midwives. And they were just, as lovely experiences as you can get out of childbirth, really.
Awesome.
And so everybody's healthy and brilliant. And
So from your personal experience then, so obviously you felt the confidence and had a totally different experience having the home birth versus having the hospital birth. And with women coming in not knowing about their choices from the very beginning, so this would be like, prenatal and everything. So do you open it up to having those conversations to kind of like talking about here's some things here's what a home birth could look like, but also within the home birth you can have water birth or maybe you're squatting next to the chair, maybe you end up being on your own bed, and like there's so many choices even with home births. So do you kind of present that like
for sure. So I've got Evidence-Based Birth is an excellent website for all kinds of research that can back up the statistics and things that we look at. But what we do know is that primary C-section rates in the United States for uncomplicated, head down, first babies with no complications whatsoever.
Right.
In the United States, that rate hovers right around 25%. C-section, primary C-section, that's first time moms getting their C-section, 25% of low risk pregnancies.
And they're getting unnecessary C-sections, you're saying, in this case?
Well, 25% is well outside of the World Health Organization recommendation of 10%.
Yeah.
If we add in the other ones, it is closer to 33%. If we compare that to home birth and birth center births, we've already accounted for low intervention. I mean, for low complication, no complications.
Low risk, yeah.
Low risk births, they're across the board. We've already adjusted that. For home births, C-section rate is 5%. For birth center births, it's 6%. The only difference there is care providers and location.
Yeah.
So we know that makes a big difference. And I'm not saying that every single person should have a home birth, because that's just
it's decision.
Yeah. If somebody does not feel comfortable birthing at home, they shouldn't birth at home.
Right.
I mean, obviously, we'd love for them to be educated and understand why they are choosing the choice that there is. Are they making a choice out of fear?
Yes.
Or out of comfort?
Yeah.
But
or
just having those options.
Lack of knowledge. That's the other part too, because mainstream media and everything always shows a picture of the woman on the gurney getting rushed in,
right.
breathing heavily to get in there, and so that kind of is the brainwashing that happens from a very early age, right? And that it continues on from there. And then some people, if they make their decision, they want to know exactly when they have the baby at this time, and it's their decision. But I love it that you're very much like pro-knowledge and pro-choice in that relation of like having the knowledge, and your decision is your decision, and you'll help support them wherever they're at.
Yeah,
meet them where they're
definitely.
at. Love it. That's exactly where we are. So we kind of already touched on your views on prenatal and postnatal care. What is your favorite thing about working with pregnant moms?
I love working with pregnant moms because usually when someone realizes that they're pregnant, or whether they're seeking to be pregnant or it's a happy accident, they come to a realization that they need to do something, that their life they need to make some adjustments to their life, and for a lot of people that means adjusting their diet. For a lot of people that means adjusting their movement patterns, getting more exercise,
adjusting their spine,
exactly,
nervous system,
exactly, getting their building their care team. Oh man, I would feel so much better if I was well adjusted chiropractically, or if I got prenatal massage, or whatever it is, all of these different things. So they're looking to understand their bodies. They're looking to understand how they can have the safest pregnancy, the best, most comfortable pregnancy.
Yes.
And if I can get them at that point, either pre-pregnancy or during pregnancy, and fill them with not just knowledge and information, but the skills and the confidence to find their own information, to be empowered to it's not just like, this is all that you need to know, but this is, let me help you find the path to make your own journey, and continue to gain knowledge along the way, and realize that you do have choices, you do have options, you should ask questions.
Right, and do your own research, but also make it easier for them, because even as a doctor, the word doctor in Latin actually means teacher. So we're always trying to teach people to empower them with their body, and you're very much doing that specifically with women during pregnancy, and then even after pregnancy.
Right.
Because there's ugly things that happen, afterwards too, and I'm sure you're more than open to talking about that,
for sure.
so that way they know, it's normal for your pelvic floor muscles to be a little weak, so there might be a little bit of leaking going on, and there's nothing abnormal about that, right? But what can we do to keep things strong and regain that confidence and regain the pelvic floor muscles, etc.
Right.
The not so pretty part of pregnancy, of postpartum, I should say.
Right.
So that's great, and just really empowering them throughout the process, and education is.
Yeah, and I love being a safe person, because some people, they don't necessarily need professional counseling at a moment, that they need somebody to listen,
or they need someone that just,
or they need somebody that understands, or they need just a trusted person who can say, hey, look, you should call somebody, you should call a doctor, or you should, get professional help, or whatever it is. I field a lot of support calls and visits that it just people need somebody that they can
trust.
that they can trust and ask questions of.
Right. Yeah. Oh, that was a whole nother thing. I love where we're going with this, because that's the other part too, is some people, you can, because the hormones are they go so high, and then they change as the baby comes out, it does mess with your hormone profile as a woman, that they can go through postpartum depression and stuff like that. But I love that you even said maybe they just need to talk to another woman or talk to somebody else. It doesn't necessarily need to be, you need to go to the psychologist, or you need to go to somebody to prescribe you, the depressive medication.
Right.
Maybe you just need to have that confidence in knowing, hey, this is normal right now that you feel uncomfortable with this. Let's just talk about this, and maybe try this or try that, and then they can avoid having to be on that medication entirely and get even more disconnected from themselves. It's just really gaining that support and that confidence, and it's just so beautiful. And can you not feel, we can all feel the love and passion that you have with what it is that you do. So as we wrap this up, I could go on and on. I just love having these conversations right here. But in your opinion, what do you think is the most important thing a woman needs to know or do to have a great pregnancy?
I think that the most important thing that a person needs to do is find the right care provider. Because studies show that no matter what the outcome is, if a woman feels supported, safe, and heard, it doesn't matter what exactly the outcome is, she's going to feel better about the experience. If you can have open communications with your care provider, if you can ask questions and feel like the answers are suitable for you, if you feel like you can express concerns and that they're heard and addressed, if you feel safe and supported, then you're much more likely to make decisions from an educated perspective instead of a fear or reactionary perspective.
Right.
Your care provider is going to listen to your concerns and meet your needs where you are.
Right.
Or if something does come up, you know that you can trust that they're helping and guide you down the safest road possible. If a variation presents itself or a complication arises, you don't want to be in that situation questioning, well, is this just part of the machine, or is this something that I actually need?
Yes.
Being able to trust their answers. And so I always advocate for people to, if you get to a point in your pregnancy, or if you're interviewing care providers and you think, that's not the person for you.
Not a good fit. Yep.
You want to feel like, wow, yes, this is it. And fortunately, we have a lot of good care providers. We have some excellent OBs. We have some terrific CNMs, certified nurse midwives who work in hospitals.
Okay.
And we also have a lot of excellent midwives, home birth midwives as
Okay.
well. And so we have a lot of options. And we don't have the birth center anymore. We had a few years ago. But we do have a couple hospitals that have a low intervention suite.
Right.
And in order to use the low intervention suite, you have to have had a childbirth education class, and my class
great.
qualifies. So
Wonderful.
So I see a lot of those people who are looking to get that suite. And so yes, choosing your care provider wisely is probably
Most
top of my
important.
list. And then from there, building the team around you, getting your chiropractic care, getting your finding an awesome massage therapist that knows what they're doing.
Yes.
Hiring a doula.
Yeah.
We have a terrific doula network in Northwest Arkansas. Finding a postpartum doula that will help take care of you and your family after the birth so that you can have a good recovery. And of course, taking a childbirth class.
Yes.
And working with the birth prep and prenatal workshops and things like that, for sure.
So that really very much went into probably the same thing you would highly recommend going into delivery, is really planning before you go into delivery would be the best thing, right?
Yeah.
Oh, wonderful. So, I mean, this has been a wealth of information. I'm sure the listeners are going to be so excited to hear this. I know patients that come into our office are going to be so excited to know of how extensive this resource and network can be. So that being said, how can the listeners or people find you? Where's the best place? What's your website?
Sure. So you can find me online. My website is www.nourishstudio.nwa.com.
So nourishstudio.nwa.com.
And then, so email is basically nourishnwa.com. And then I'm on Facebook, Nourish Studio NWA. If you search that, or Nourish Studio Birth and Beyond. Birth and Beyond is my childbirth course.
Okay.
You can find me online as well. Yeah.
And so is there a way that's better than the other to reach out to you? I'm sure online they probably have a number to call you.
Yes. So all of my contact information is on those pages, either my web page or my Facebook page. If you're curious and you're I want to do some more looking and see who this person is, definitely go to either of those places or both, and there's different information in both places, and just kind of feel it out.
I love it. Yes. Well, Susan, thank you so much for being here today. Thank you so much for sharing that and sharing your confidence and the support, so we can support our women around here, locally here in Northwest Arkansas, and then definitely just really providing information for other people in other areas so they can look for another Susan around there as well. So
of course.
I definitely see us being able to have future conversations, probably hitting on some other topics, but we'll stop right here and keep the excitement moving forward. And again, thank you for being here. And listeners, thank you for listening right now, and followers. You know how to find her. And again, I'm Dr. Natalie Horine with Ignite Chiropractic, wanting to ignite your health to help ignite your life. And as Susan's going to help support you throughout the pregnancy process, before, during, and after, we would love to be able to help you out and help you along that journey. Have a good one now. Bye.